Body-worn cameras for EMS. How do you feel about EMS wearing body-worn cameras? I used to be firmly against this, but I have moved from one side of the spectrum to the other. The reason why I used to be against it were twofold. First of all, I felt like that there are a lot of providers who are self-conscious and they're not confident in their capabilities. And when they know they're being watched and they feel self-aware, they are inclined to not perform interventions that they're not very confident in. And the other reason was the amount of patients that we have where we need to have some sort of trust between the provider and the patient so the patient can reveal some sort of embarrassing information, some sort of incriminating information, some sort of deeply personal information that would be very helpful for us as far as treatment goes, and the presence of that body-worn camera could compromise that trust. What moved me from one side of the spectrum to the other are all the reports that we see from other body-worn cameras, from police and from people in the public who are filming with phones, or from Ring doorbells, that sort of thing, where EMS personnel are abusing patients. Either they are literally abusing them, throwing them on a stretcher, transporting them prone where these patients have died. They're neglecting them by leaving them on the street without treating them, like what happened in Rochester. They're forcing these patients to crawl up in the ambulance when they lack the physical capabilities. And I believe that we have an obligation to protect our patients from us. And I think that the body-worn cameras are good accountability there. I also think that body-worn cameras are our best protection when false accusations are made against us. And they are a good QA tool when it comes to reviewing critical calls. Is there a risk that they could be used punitively against providers? A small one, yes. Overall, I think that the negatives are far outweighed by the positives. I do think, however, that providers should at any point in time be able to very easily track who is accessing the data on their body-worn cameras and how that data is being used. And if somebody does access that data and there's no accompanying run number or some sort of complaint through a phone call or a text or an email that's not actually documented, I should literally get a push notification.